The broadcast is now starting. All attendees are in listen-only mode.
Thank you, everyone, for joining us today. My name is Mari Sarmiento, and I am your channel manager here at Next Trust Bill Flash. We will just give a couple of moments to let those who are still joining us log in. It'll just be one more moment. Thank you. All right, we'll go ahead and get started. We appreciate you taking your time out of your busy schedule to join us during our webinar series. And today we will be talking about ways to ask your patients for payments. Our Vice President of Business Development and Customer Support, Tony Peterson, will be presenting this event to you today. During this meeting, you can ask questions through the dashboard under the Questions tab, and we will address those and answer those questions at the end of the presentation. This webinar will be recorded live and a copy will be emailed to you later this week. We hope you are healthy during this pandemic and safe during the storms across the country today. At this time, I'd like to turn our time over to Tony. Thank you.
Thank you, Mari, and thank you all for taking a little bit of time out of your very busy schedules to speak with us today. Hopefully this is something that brings a lot of benefits to you and your businesses, your practices. We're going to be talking today about 7 ways to ask your patients for payment. This is a topic that has been very, very popular with our customers and within the market because the pandemic has really shifted the way that healthcare is delivered within the United States. And it's more and more important that we continue to ask our patients to pay for their bills and to find new and innovative ways to incent and try to drive them to do so. What I would like to challenge each of you to do during our presentation today is think through your practice and think through some of the mind shifts and changes in thought that you might have to take in order to be more successful in collecting from your patients. There's a lot of different things that we will be discussing today that you can implement with very little effort, one way or the other. These are things that just involve a slight change in how we talk to our patients or when we talk to our patients. So please, as you're viewing the presentation today, ask yourself, are there things that we could do differently starting today that would make it more likely that our patients are going to pay for their care in our practice? Because that's going to make us more successful as a practice and significantly increase the likelihood that our businesses are going to survive and thrive. All right, let me see if I can get my screen to advance. There we go. So the 7 different ways that we're going to talk about today, how you can ask your patients to make their payments or talk to your patients about paying their bills, are up on the screen here now. The first is keeping a simple approach, trying to make sure that the patients can understand what it is that they're being asked to pay and how they are being asked to pay that.
Tony?
Framing the message.
Tony, yes. I do apologize, but it's not advancing.
It's not advancing?
No.
Is it advancing now?
Now it's advanced.
Good job, Mari. That's exactly what we needed to do. Like I said, the first is keeping a simple approach. Second, framing the message, making sure that the way that you speak to your patients increases the likelihood that they're going to pay. There's a number of things that you can do that make it more or less likely that somebody pays, and framing the message is important to make sure that they know this is what we're being asked to do. You need to connect with your patients. You need to understand what's going on in their lives. Have they lost their job as a result of the pandemic? Have they had health concerns? Have they lost a loved one as a result of what's going on in the world today? There's a number of different things that can affect your patient's experience with you. And the ability to pay is greatly impacted by a lot of those things. Aligning with future actions, making sure that the patients know what they need to do in the future and that it's not just an afterthought for them. We need to identify risks. What are the likelihoods that certain patients are going to pay or not pay? How do we eliminate those risks? How do we minimize them? How do we make sure that we're collecting from as many patients as we can the payments that they're required to pay? And then the last two that are on there are sort of combined with each other. They're very related, and we'll talk about them in a little bit more depth later on. Those are creating incentives and establishing a reward system. So if you think about these things, these are the ways that we're going to talk you through helping your patients understand what they need to pay and that they need to pay, and how you can ask them to pay their bills. All right. Let's start with number one, a simple approach. Numerous studies out there show that people are more influenced by simple, easy to understand options. This creates trust. Why does it create trust? Well, it creates trust because if it's easy to understand, then the patient knows why they're being asked to pay what they're being asked. They know when they're going to be expected. They know what they're paying for. The healthcare system is really difficult for a lot of patients to comprehend because they are expected to make a decision to consume care before they have any clue how much it's going to cost them to consume that care. If they understand upfront how much their bill is going to be, or somewhat close to what their bill is going to be, and they understand how much of it they're going to owe versus what their insurance is going to owe, if they have that connection in their brain, they're far more likely to trust the bill that you send to them. If they trust the bill that you send to them, they're even more likely to pay it. The whole point of sending someone a statement or a bill or seeing patients, we really want to make sure we get paid. Our businesses need to thrive. They need to continue to go. So we need to get paid in order for that to occur. If we keep things simple and the way we talk to patients about payment is not full of legalese and jargon that they don't understand, they're going to be far more likely to pay. So what do we mean by a simple approach? The goal of a simple approach to communication is to remove any obstacles that you may have to communicating this with your patients. You need to simplify the message so that they're going to trust it. So what I've got up here are a couple of different scenarios that I'd like to run you through and share with you how you might be able to change how you speak to a patient regarding their balance, their bills, their care within your practice. In scenario one, we're talking about scheduling an appointment. In this scenario, we want to make sure that at the point the appointment is set, that the copay expectation is set and paid in advance. We want to make sure that before the patient goes in and is seen by the provider, that they've paid for the visit. Ideally, they should have paid for the visit before they even walk through the door. One way that you can do this is using the script that we've got there before. When you're talking to a patient, whether in person, on the phone, over the internet, your appointment is set for Thursday at 4 p.m. Your copay for that visit is going to be $25. We take credit, debit, or I can send you a link to our payment portal now. That is far different than sending a patient a big, long financial disclosure form or a financial billing form, financial policy form that has a lot of fine print that they don't understand. You are setting the expectation for them, but that before they ever even step foot in the office, you expect them to pay for the services that they're going to be consuming. There's also scenarios that exist where the balance is there from a previous visit. Now, hopefully, as we move on through our process and we change how we talk to our patients, change how we think about this, we have less and less of this because we're collecting prior to the visit. But if we take a look at the script over here, this is a patient that has an outstanding balance of $125. So if you were confirming an appointment for a patient that has an outstanding balance of $125, that you could use the script as follows. Hello, Mr. Jones. I'm confirming your appointment for this Thursday at 4 p.m. I see that you have a balance of $125. We can take care of that now to save you time when you get here. How would you like to pay your balance? You could even add on, we take Visa, MasterCard, and American Express, or whatever it is that you would like to add on to that. But you're not overcomplicating that messaging that they owe that money with other things. Like, if you would like to see your lab results, do this. If you'd like to talk to somebody about scheduling another appointment, do this. You're really focusing the communication and the discussion with them in this sentence on, you need to pay the bill. And you're not letting them continue until they've made the payment or made an arrangement to pay that balance that's outstanding. That's another thing, that as we move through the discussions that are here, we're going to be talking a lot about asking for the payment prior to the visit. One thing I want you to all understand, there's a lot of different workflows that are out there in the medical industry. Some of you will be able to collect easily prior to the visit, others might not. We're going to talk about things like automatic payments or payment plans, things like that you can set up to give the patients a way to commit and to make their payments prior to the visit without expecting them to pay the entirety of any balance that they might have. You don't have to take all or nothing. It's better to get half of the payment that is outstanding from that patient at that point in time than it is to get none. So make sure that you're asking for that balance and that you're giving them options. If they can't pay the entire amount right now, take what they can, or set them up on a payment plan or an automated plan a little bit later on. Let's move on to framing the message. This is really talking about how you discuss something with the patient. What are some of the words that you say when you're talking to or interacting with patients who either do owe you money or will owe you money? Really, when you're speaking with a patient about the financial responsibility that they have, the question needs to be framed to elicit a no-brainer response. What that means is that you're not asking a question and letting them guess or letting the patient decide, you know what, I'll pay my bill in August of 2021 because I don't want to pay it right now. You're not giving them options that are going to confuse them or delay the payment that they're going to make. You want it to be a no-brainer. So I want you to think a little bit about the check-in process. When a patient shows up at your practice and you're giving them their sheets, their forms, their intake forms that they're going to be filling out, are you giving them options that ask them to put their credit card on file, to scan and go, asking them to pay the entire amount right then and there? Are you giving them the options on your intake forms to sign up for payment plans or automatic payments? Most of the practices that I've seen will set up a financial policy form, and it says the patient acknowledges that they owe anything that the insurance doesn't pay, in much more legalese than that. That form does not mean that the patient is really going to pay. It means that you have something that they've signed that you can take to a lawyer if you have to sue them, or if you need to send them to a collection agency. But that's not our goal. Our goal is to actually get them to pay. So consider on your intake form giving them these options. Let them put their credit card on file so that the next time you don't have to ask for it. BillFlash has options that allow you to store credit cards as a token, which means we're not actually storing the card number. It's a token that links the patient to your practice. So storing those things on file isn't a HIPAA concern. We're not storing the credit card. We're PCI compliant. It is an encrypted value that only can be used by your practice to bill the patient. It's completely secure. A patient putting that on file means that they're more likely to pay. If they don't have that on file, it's going to be a difficult conversation every single time. The next scenario we'd like you to consider is setting up automated payments based on recurring appointments. The communication script for you could be something like this. You're scheduled for a visit on May 5th. Several of our patients choose a specific day of the month for their payments to be made and have set amount determined based on their account, the number of visits that they have. Would you like to, or can we set that up for you right now? And then you take them through and set them up with an automated payment plan on Bill Flash that will collect $20 a month, $100 a month, $200 a month, whatever it is based on the patient's balance, the care plan that you have for them. If you're seeing them 3 times a week, you might want to collect more. If you're seeing them once a month, it could be a little less, all depending on the types of visits and the types of practices that you have. A chiropractor's ledger sheet is going to look far different than a cardiologist, and that's okay. You need to find what makes sense for you and your practice, your patients. But setting up those automated payments prior to the visit means that the only way you don't get paid is if their account is empty or the card expires. If they don't have any room on their card or in their account, or if the card's expired, you'll get a message saying that we couldn't process it. But otherwise, you and your business, once you've gotten that automated plan in place, don't have to think about it anymore. And you don't have to pay someone to follow up on it because it's going to be automatically recurring. It's really important for you to frame these things in a way that makes sense. And you need to ask them in a way that doesn't give them another choice. If you give them the options on their check-in to pay and you make them choose one of those, they're going to. Not every patient is going to love it, and some of them may come and ask you about it. But if you can get a fair number of them to utilize those things through this change in your process, it's going to significantly increase your cash flow. Another thing that we want you to consider is using things like QR codes or signage in your office to let patients know where they can go pay. We've created a little QR code here that you could put onto a paper and frame it and put it in your waiting room. You could print it out on a cling that you put on your window or at your front desk check-in. And if a patient scans that with their phone, they'll be taken right to My Provider Link where they can pay for their visit to your practice right then and there, reducing the amount of touch that you have. If you had that on your front door in COVID world right now, you could make part of your check-in process for your patients that they come up to the front door, scan the code, pay their copay, and then come in. So they're not even walking through that door without making sure that their payment has been made. It also reduces the interactions that they have to have and the amount of time that they have to interact with different staff in your office. So in the COVID world, that makes it a whole lot better for social distancing. This is a huge tool that can help your practice collect more money by telling the patients where they can easily go make a payment. This is something that we've created. It's in our PowerPoint deck here. We will be sending out a PDF of this to every single attendee on today's call. So if you sign up for Bill Flash Pay Services, you'll be able to take this, drop it on your window or frame it, do whatever you'd like to do with it, have it there in your waiting room, and your patients will be able to scan it and go right to the page where they'll be able to pay for their care. Very simple. Taking and making it a no-brainer by making it easier for them to get there is important in framing the conversation. The next piece, connecting with your patients. We'd like you to connect with your patients and help them feel like the decisions that they're making and how they interact with you make sense. Referencing how other people are solving the same problem encourages them to do the same. Think about things like we have here right below. This is a data point. 91% of millennials trust online reviews as much as friends or family, according to Bright Local. Online product reviews about a product can increase the conversion rate by more than 270%. What is this saying? It's saying that your patients are looking at Rate My Doc, they're looking at Yelp, they're looking at Google reviews, they're looking on Facebook, they're looking at different places where they can find out what somebody's interaction and experience with you as a business has been like. It's important that you keep your eye on this, that you manage your online profile, that you manage the reviews that you have, that you respond if there's any concerns that are brought up in those reviews. When you do those things, your patients are going to trust you. If they're looking to those online reviews and you're ignoring that, it's going to exacerbate the problem, and you may be losing patients without even knowing it. You may be losing business from people who simply just look at that and say, you know what, I'm going to go somewhere else because Dr. Smith decided he wasn't going to manage his profile. And there might be something in there that completely is not valid, but you don't know unless you manage that profile and manage your reviews. So how do you influence your patient with reviews? Well, think about asking your patient to make a review and offering them a $5 product or something if they give you a review. Ask them to plan their payments based on recurring appointments like we've talked about before. Ask them to talk about something that only your practice has. Ask them to review your practice for your financial policies. Talk to your patients about the importance of leaving a review. If you make it easy for them to set up a payment plan, ask them to talk about that in a review that they post for you on Google, Facebook, Yelp, wherever you want to do it. You need to communicate with them and have them be your helper in communicating out to the rest of the world how your policies are making it easier for them to be a patient and to pay their bills. All right, let's talk for a minute about aligning with future actions. How do you intend to pay is the question that we're talking about here. This is a contract between the practice and the patient of how and when the payment is going to be made. The when is quite important to this process, and I am going to be a broken record, and I'll say this on this webinar and every other one that I do for the next foreseeable future. When needs to be before the visit in almost every circumstance if you want to be likely to pay. So everything that we talk about in this section is something I would encourage you to examine your processes, examine your intake, examine your scheduling, and figure out, how do I move this conversation to prior to the visit rather than after the visit? Let's talk about how we do that with a couple of scripts here again. We want to first figure out, does the patient intend on paying? Yeah, if they do, then we can figure out what we're going to do about it. Let's go through another couple of scenarios here. There was a potential balance of $25 for a copay for a visit that I had today at Dr. Smith's office. The communication script that Dr. Smith could have is, how will you settle the balance of today's visit? Or how do you intend to pay for the remainder amount after the insurance has paid their portion? When the patient says, I'll pay it by check, that is where you need to jump in and ask them, incent them, encourage them to set up a payment plan with you, to prepay any balance that you might see there, or to sign up for auto pay. Auto pay is an amazing feature that lets them pay their medical bills the same way they pay their electric bill, where they can sign up to have it automatically withdrawn out of their account with a cap that is set and determined on a patient-by-patient basis. So if you have the ability to have a patient sign up for an automatic payment of up to $100 prior to the visit, and you think that the visit is going to cost $90, getting the patient to sign up for auto pay before they're seen by the doctor increases the likelihood that they do. And if they do sign up for auto pay, the second the statement goes out, they're billed. You don't have to worry about collecting and chasing that money. It's going right into your account. Ask them how they want to settle the balance and encourage them, suggest to them payment plans, automatic payments, payments on file, things like that. I'm going to skip scenario 2 for just a second and come back to it because I want you to read the sentence there at the bottom of the screen. Financial policy is not an intent to pay. Look at your intake forms. We've talked about this a lot already today, but just because you're having them sign your financial policy does not mean that they intend to pay. You need to get them to explicitly intend to pay and set up either an automatic payment, a payment plan, or a stored payment method before you see them. And then you're going to have a much easier time getting them to pay. Let's come back to scenario number 2. A patient inquires about a payment. Communication script. How do you plan to pay? You ask the patient. If the patient says that they want to pay online, you can then send them a copy of that statement immediately. Send them an e-bill with instructions, with a link to your online payment portal, with the QR code that lets them go there and pay the way that we talked about earlier on. When a patient calls and asks about a bill, if they say they're going to pay online, you want to make sure that you suggest to them the plan pay, auto pay, stored pay type options, because if they don't know about it, they're not going to ask for it. And the patient wants to delay the payment as long as possible. You want to move that payment up as quickly as possible. So make sure that you're suggesting those items out to those patients as you're communicating with them at that point in time. All right, let's talk about risks. As with not everybody, but most people often choose the least risky option if they're given a whole bunch of options, different ways to take care of something or to solve a problem. People don't like risk in a lot of circumstances, and they try to avoid it. Businesses really try to avoid risk because risk means that you don't know something. You don't have control over everything. So what is the risk and reward, or the risk-averse scenario for you on payment? Well, the risk to you if a patient owes $500 is that that patient pays $0. If a patient owes $500 and they decide to pay $0, you as a business have now lost $500. You can try to collect it, you can write it off. Either way, the amount of revenue and margin that you're going to get out of that interaction is going to be greatly reduced because the patient is not necessarily going to pay it if they don't think that they're able to. So think about ways that you could reduce that risk for the patient. Look at the script that we have there under scenario 1, a discount today, full pay tomorrow. The communication script you could use would say something like, we estimate the cost of today's visit will be $500 after your insurance. I've broken that into 5 automatic payments, or I can give you a 10% discount if you pay in full today. When you have those communication methods or those communications and those conversations with those patients, you'll have some that take you up on paying the $500 today. You'll have a few that set up an automated payment plan, but either of those scenarios are better than letting the patient say, I'll pay you when my insurance pays, because they're not going to. They're going to get the statement from you, and the next time they're most likely to pay is the next time they walk into your office waiting for an appointment. So you need to get them to set that up today by offering them a scenario that has a reward or a reduced risk if they do what we want them to do today, and a higher cost to them if they wait and sort it out later. This is standard practice in business and out in the world, in the financial world. It's important that we start to adapt. Take a look at your friends who are dentists. They've been really good at this for a long time because they've had a higher patient responsibility for a long time. But if we start to adopt some of those same methodologies, I think that it's going to really increase the value of our businesses and the likelihood that the patients are actually going to pay. All right, let's go over to scenario number 2, clearing up balances. Imagine a patient calls in. They have a $600 balance. You ask them, can you pay it now? They say no. You could say, I see you have a $600 balance with us. I can try to have that reduced by 10% if you would sign up for an automated payment plan today, or if you pay in full today. Think through the options that you can start bringing to your patients. Giving them those write-offs if they pay in full or move through the system are going to incent them appropriately and get them to do what they need to do. If you ask them prior to the visit, they're also going to be way more likely to do it because they need something from you at that point. They need to be seen. Once they've been seen, the patient has what they need, and they're going to, in many circumstances, hold on until the next time they need something from you again. All right, we've gone through a lot of these things. We're on the last little section here. Hopefully, if you have any questions, you're typing them into the question and answer interface here for GoToMeeting. We'll be answering those in just a minute, but we're gonna go through our final 2 points here, sort of combined as one, because incentives and rewards can be seen as very similar, if not the same thing in certain circumstances. But I want to read the quote that we've got there for you on the screen. Defying conventional logic, consumers are more drawn to free items more than they are to discounted products, even when the discount helps shoppers save more money or get more value from their purchase. What that really means is that giving somebody a free t-shirt is often more appreciated and more effective than giving them a 20% discount. So if we take a look at our practices and say, are we creative in creating incentives and rewards that drive our patients to the behavior that we want them to take? In this circumstance, if we put into place incentive and reward programs for prompt or early payment, that can drive patients to say, you know what, I want to earn that t-shirt. I want to get a movie ticket. There's any number of things that you can set up and create for an incentive or reward program to help those patients see that benefit. But you need to align them along the behaviors that you want to incent. Very often that alignment is strictly around scheduling an appointment in practices. That's where I'm suggesting you want to align it not only around the appointment, but around the prompt or early payment of their bills. So let's take a look at a gift with payment, a physical gift. In this scenario, we're not going to offer the patient a discount if they pay early. We're going to give them a communication showing the gift of the month. So in the script, it's not really a conversation, but it could be emails that you're sending out to your patients, showing them their gifts. And if you create a system that provides points to those patients for doing certain things, like paying their bills online or paying them early, then they rack up those points and they can purchase those things. We are not sharing links to the specific vendors that do this on the webinar here today, but if you go out there and Google, there's a number of programs that will set this up for you and your practice in the medical world. My children's orthodontist had a program like this with a card that we would come through and scan every time we scheduled an appointment or made a payment. And we got points that we could spend within this program. It wasn't something that they created on their own. It was something that they found and they used it to help drive people to their practice. If you take a look at the quote to the right there, this really goes into what we were talking about on the previous slide. In 2012, the magazine The Economist found that many buyers preferred getting something extra free to getting something cheaper. Sadly, the explanation for the behavior is not really flattering. It's less than flattering. The main reason is that most people are useless at fractions. In my time in the industry and with dealing with patients, I have found that to be absolutely the case. So if you take a look at the options that are out there, that you can give somebody a reward for doing what they need to do, it's going to be far better than trying to get them with a reduced cost that they don't understand. So how do you establish a reward system? It's really easy. Think about the point systems for hotels or airline miles programs. That's how a reward system for your practice can and does work. You could sign up with medical savings books. You can create value. You can give coupons for 10% off. You can identify services that your practices has. You can provide them with a coupon that says, gives them 10% off when paid in full. You should include content with that about staying healthy. But as you reach out to your patients and provide them with these options to create value for them, to make it easy for them, you might not have to get creative with how you price or write off their balance. If you give them a reward every time they pay their balance in full, even if it's just 100 points, and those 100 points can get them a Tootsie Roll like they were at Chuck E. Cheese, that is something that can bring patients to you. I also want to point out that in the pandemic right now, practices all over the place are experiencing a reduction in the number of patients that are coming in to have their visits. People are avoiding going to the doctor in a number of different scenarios right now, and that's resulting in a reduced revenue to many practices, and it's also resulting in a drive to find more patients. I want you to consider that if you are not offering a rewards program or an incentive program like this, other practices that are looking for patients and looking for revenue right now are signing up with these things. And patients will move, not every patient, you'll have some that you have, and maybe a lot that you have a good relationship with, but you will have patients who make the decision to go somewhere that gives them an experience that you're not. So make a decision. We're going to do this or we're not going to do this, and here's why. But know what the result of those decisions are going to be. It's going to be much better for you if you create a plan and you follow that plan and you know what's going to happen than if you just say, we're going to see what happens, and then you don't really know why the patients might be leaving, why they might not be paying, etc. If you take a look at all of the things that we've talked about today, the ways that you can communicate with patients, the way that you can ask them for payments, can all be supported by the BillFlash platform. We offer the ability for you to have online pre-visit payments, in-office payments, text, email, bill notices. We can let the patients pay online post-visit. And we offer stored and automated payment plans and automatic payment methodologies so your patients can pay their bills just like they pay their electric bill. All of these things are tools that don't do anything for you if you don't change your processes and the way that you talk to your patients, the way that you interact with them, the way that you intake them into your practice. You have to change the conversations and start to ask them to utilize some of these things. Otherwise, they're going to make the choice that is best for them. And the choice that is best for them in their mind is waiting to pay until I absolutely have to. So let's reach out to our patients. Let's find ways to make it easier for them to pay. Let's be compassionate to them and set up payment plans if they've lost their job, or delay a payment if they aren't able to make a payment right now due to some of the financial difficulties that are out there. But without an increase in communication and a change in the way we communicate with our patients, none of this is going to be possible. If you have any questions about anything that we've talked about today, we have a number of consultants that are standing by that we can schedule a discussion with you where they can take you through and show you how all of these things would work within your practice and your system. We've got some contact information that's up here on the screen, the phone number, email address. We have a free trial for those that are not customers right now, where you only pay the price of a stamp if you utilize BillFlash to send out your statements and your bills that are there. We've got a poll that we just opened. If you look in the GoToMeeting, there's some questions there that we'd like to, if you have a few minutes, you can go and answer those. And I believe, Mari and Kathy, do we have any questions that have come through during the presentation today?
Tony, we do have a few questions. Let me just start with our first one. And that is, how hard is it to link an unlinked payment made through my provider link to a client account?
That's a great question. An unlinked payment through my provider link to a provider account is very easy to enter in there. The way that you would do that is through a report, and you would do it just like a paper EOB. So if you send a bill to an insurance carrier and they, sometimes they'll send you, most of the time they'll send you back an 835, and you process that with your practice management or EHR system. In some circumstances, they send you back a paper EOB that you post manually. You would follow the process that you would for a paper EOB to post an unlinked payment manually back into your practice management system. So you'd take the payment report, it would show you your unlinked payments, and you'd go through and enter those with their account numbers into the practice management system.
And then another question we have is about text bill and notices and how soon that will be available.
Text bill and notices it's a great question. What we're talking about here is the delivery of an electronic statement or a notification of a statement via text. We are signing up early adopters of that over the next few weeks. We anticipate that within the first quarter of 2021 that it should be generally available to everybody.
And then we do have a question. I hope I'm going to translate this correctly, not translate, but offer it correctly here. There is a practice that recently updated their website, and they have a Pay My Account tab on their website. It sounds like they want to know how they'd be able to link that to the My Provider link on their website.
We can absolutely help you with that. What I would ask you to do is please schedule a session with one of our consultants. You can, if that was submitted through the GoToMeeting question and answer, we will have someone reach out to you to help you set that up.
And then I do have a couple more questions. I'm going to address one really quick, and that is, will we be sending the questions and answers along with today's presentation? That is included in the recording that will be sent to you this week. And then it looks like we have a question. How would you frame a message for a patient that has purchased a DME, durable medical equipment, that has a balance and the provider contract that limits the office from offering a discount? And it looks like they've already exhausted all their options as far as trying to collect from the insurance company.
So that is a really good question, and this is why it's important that we get this conversation ahead of the visit. So I don't know if your contract prohibits you from offering a discount to the patient, then I don't know that there's a ton that you can do after the fact to drive them. You may want to look at the communication with the patient's insurance carrier, because in a lot of circumstances, if they prohibit discounts, then their expectation is that the patient is paying the balance. And if the patient isn't paying the balance, then they're not living up to their responsibility, and they can receive some trouble with the insurance carriers as well. So for this particular scenario, you may want to reach out to the insurance and let them know that the patient is not paying, because they will have some things that they can do to help drive that. But if you are in this scenario in the future, I would definitely ask each of my DME patients to sign up for auto pay before, or plan pay, one of those two, before they are seen and before they're provided with their equipment, because otherwise they have what they need and they're not going to pay. So I would communicate with the insurance carrier for the one that is not doing it right now. You can talk to the patient and let them know that you're not going to be able to provide them services anymore if they don't pay, and that would be something I would recommend doing. But for future reference, signing them up for an auto payment or a plan pay prior to the visit is going to be far more effective than trying to chase it down after the fact.
And then it looks like we have one more question, and that question is, what was the link? Red Spot Interactive?
Let's see. That was for one of the plans, the patient loyalty programs, Red Spot Interactive. We have absolutely no connection with them. They don't know that that's on our presentation today. We were just looking for some options that are out there. We are not recommending them over anybody else. Just giving that as an example of something that is out there right now.
Great. And Tony, that looks like it's it for our questions.
Okay. Well, thank you, Mari, and thank you all for giving us a little bit of time today. We hope that this was beneficial to you and your practices. Please, please, please let us know if there's something that we can do to help you. If you need some assistance in setting any of these things up, we have a great team here that will help you set and configure all of these things. You don't have to figure it out on your own. If you are a current customer and you need help, give us a call. If you're not a customer and you'd like to explore what we might be able to do for you, give us a call. It's no pressure. Bill Flash is something that we believe in so firmly that we are a month-to-month service. If you don't appreciate and don't see the benefit out of what we do, then the next month you're gone. So there's not really a big risk for you for trying this out. We've seen it really make a difference for our practices, and we know that it can for you as well. Thank you for joining us today. Stay safe and let us know if there's anything else that we can do for you.
Thank you, everyone.